What I thought I'd talk about is research and capacity building in yourself, because these guys are more expert in terms of building research and capacity programs around the world. What I would particularly recommend is, particularly if you don't exactly know what you want to do in this area, and it's very important, what's perhaps most important is to figure out what your own particular skills, fascinations, motivations, interests are, because other people in this world aren't going to be able to tell you those things. And if you look at these projects, these are not projects really run by single people. These are people who have a whole variety of skills, and they vary from person to person. You don't have to be able to do these projects completely alone. And so you see most people probably are good clinicians who do this work. You have to kind of be able to take care of patients, but you don't have to be very good at being clinically, you don't have to be a good clinician. You can be kind of okay, and other people can fill in those gaps if you do other things. For example, obviously doing a research program is a big project. So somebody's got to write these grants. Somebody has to develop the techniques to do these projects. There's a great IPT program and a study that I saw from Uganda years ago that was really good. I think a lot of the people who were involved in that project never went to Uganda, but they were very good at setting up the IPT research project. There are some people have to do the statistics. Some people have to enact this stuff on the ground. Some people are very good at politics and like that very much. Other people don't like that whole world. Some people are very good at fundraising, working with foundations, community building, teaching, education, mentoring, grant writing, public policy, population health. These are all things that if you're really focused on these things, the international world can be a great place to work on them. You might have a calling to help the underserved, which is important if you're going to go to a resource-poor country. On the other hand, you can help the underserved by walking out your front door and helping in New York. You need to have more of a reason for that, for working with this population, than just working with the underserved. You might have a strong interest in anthropology and culture. You might just want to have new experiences and go on lots of flights. And all these things are, I think, reasonable motivators, as long as you combine them and figure out how you can find your best section. One of the other things about these projects is that, again, there are a lot of people. You have to be able to negotiate and collaborate. You have to have patience. You have to play well in the sandbox. And I think one of the things about people who think about working internationally is they can be a lone ranger in the international world, because they might be the only psychiatrist for 200 miles. And they think, well, this is great, I can be my own person, I can do my own thing. But oddly enough, you can do your own thing very much in New York as a psychiatrist. It's very hard to be effective internationally if you don't collaborate with other kinds of health practitioners, other kinds of doctors, psychiatrists, a whole range of people. So in many ways, the exploration of this outer world, this global world, is fascinating, but you really need to kind of know yourself at least as much, or you're going to flail.